Hi, good evening all. Can somebody confirm if I'm audible? Hello?
Yes, you are.
Yeah, thank you, sir. So I think we can start with the session. So good evening all and welcome to a webinar session conducted and organized by Team Prakya. As we all know, today's topic is pediatric skin disease, and the faculty joining with us today is Dr. K.S. Dinesh, sir. So as all of us know, Dr. K.S. Dinesh is an evangelist, practitioner and researcher of Ayurveda with an outstanding academic background. He had completed his UG from Vaidyaratnam Ayurveda College, Ullur. He was a first rank holder and a gold medalist. He has completed his PG in Kaumara Bhritya from Institute of Postgraduate Teaching and Research in Ayurveda, Jamnagar. He has already done more than 150 paper presentations in different national and international seminars. He is the son of a traditional Vaidya and he is now leading 4 research work in autism under different universities and institutions. He is the founder of 2 streams of institutions for autism, namely AYUCAM, that is Ayurveda Center for Autism and Learning Disability Management, and CIMCD, Center for Integrated Management of Children with Differential Abilities at Vaidyaratnam PS Vaidya Ayurveda College, Kottakkal, Kerala. He is an expert in individualization of management in autism, cerebral palsy, infertility, and preconceptional Ayurveda management. He is currently working as professor and HOD, Department of Kaumara Bhritya at Vaidyaratnam PS Vaidya Ayurveda College, Kottakkal. Sir, it's a pleasure and privilege to have you here with us. Once again, welcome, sir, and let us kindly please proceed with the session. Thank you.
Good evening and thank you, Dr. Chandraprabha, for your kind words. I am audible to you now.
Yes, sir. You are.
Is this visible to all of you? The slides? Is the slides are visible?
Yes, sir. It's visible.
Today, we will discuss about management of skin diseases in children. Of these, for a perfect management, a clear-cut clinical examination in terms of Ayurveda is highly inevitable for the successful outcome. Majority of the practitioners are managing skin disease of the children without any hesitation. But the thing is that how much percentage of success and how much percentage of predictability, that is the main issue in front of almost all the practitioners. So without having a proper clinical examination, I'm sure that the percentage of outcome will not be that much good. So initially, we should examine the child with respect to certain variables which are highly connected to the selection of therapeutics, selection of medicine. Usually, if anybody of you are in a professional background, please turn your camera so that I will be more happy to take the classes, because certainly I need to get certain give and take reactions from your face so that it will be more efficient. Moreover, if you have any doubt Don't wait for the last. In each slide, if you have any doubts, you can ask quick queries, not the detailed one. Detailed discussion can be get it done after finishing the sessions. All of you know the myth behind the production of Kushta Roga. By taking certain havis, that means certain surface, it means certain snigdha, it means certain kleda or kapha dominant. Kapha dominant upajara that has to be entered through the mouth, number one. All we know, the skin disease is primarily a Paediatric roga. So a combination of increased snigdhatvam, that too in a morbid way, not in a physiological way, that we call generally as klayadha or abhishyandhavastha. All these are the terminologies which are connected to. Of course, there are some difference between abhishyandhavastha and klayadhavastha, but in general, increase of snigdhavastha in a disease form along with vitiated pitta produces skin disease. That is the basic principle of any skin disease, including pediatric one. Not necessarily the adult skin disease, but in all skin disease, there should be a predisposing increased kledavastha and increased kaphavastha in an abhishyanta form, not in the skanda form, in an abhishyanta form, that should be associated with increased pitta. So, whenever we are thinking about a skin disease, we should have a rough diagnosis, not necessarily in terms of all these spectrum. This is quite confusing one. For a beginner, I'm not telling about a well-versed practitioner. For a beginner, diagnosing in terms of Shudra Kushta and Mahakushta is a tedious job. When you come across with Arogya Raksha Kalpadrumam and Vaityataragam, again, the clinical intricacies are much more. So diagnosis in terms of these morphological features are not necessary. But still, if you have this type of diagnosis, that's quite better, no doubt. You know, out of all the skin diseases, main three categories has to be separated in your diagnosis. Otherwise, selection of medicine will be.
Quickly, I get some thoughts from Agni of 1 or 2 points, and then we will come back again, round up the event at the end of the session. Agni, namaskar.
So these three discrimination, number one Vidradi, number two Kushtam, number three Visarpam is very important. Why? Because these three holds different involvement of different samprapti. So we need to have different medicines for all these three. The medicine for Visarpa may not have lock and key mechanism of curative outcome in Kushta and Vidradi. And similarly, Vidradi, Kushta and Visarpa, these are the three terminologies we should have in the diagnosis for a perfect management. For example, in almost all the Vidradi, yes.
Sorry to interrupt. We are still on the first slide. I think, are we discussing the fourth slide as of now?
Yes. 1 minute. Can you see this?
Yes. Thank you, sir. Thank you.
Is it moving? Let me see.
Yes.
Is this moving?
Yes.
Yes.
Thank you.
So we should have minimum 3 diagnosis of the skin disease. Number 1, Vidradi. Number 2, Kushta. And number 3, Visarpa. Why? Because Vidradi is more Vada dominant. It can be seen in any Roga Marga, either in the Costa or it can be in the Bahya Roga Marga. It can be in Madhyama Roga Marga, even in Hridaya, or it can be in Snayu, or it can be in Sira. So this is more Vada dominant. And Ruksha Ahara Vihara is must, along with the Pitta Vardhaka Ahara Vihara in case of Vidradi. See, Rasa, Rakta, Mamsa, Medas. These are the main 4 doshyas which are involved in Vidradi. Asti Snayu Kandra can also be involved. All of you know the osteomyelitis like Asti Vidradi. All these are quite common nowadays among the practitioners of Ayurveda. But when you reach the Kushta, the role of Vada dosha is only for the propelling force for the Tivyagada dosha of Pitta and Kapha. Not much Vada is involved in Kushta. Rasa Rakta Mamsa is the chief doshas which are involved. Doshaha Pravadya Tivyak Togarasiga Srigamisham. Only Bahiroga Marga is involved in Kushta. But so far Visarpa is concerned, even though Pitta and Kapha is involved, Prabhala Pitta. It means that we should manage the Visarpa by looking into first Pitta dosha. In Vidradi, first Vada dosha. In Kushta, it can be Pitta or Kapha. So Prabhala Pitta is there in Visarpa. Same to Kushta, Rasa Rakta Mamsa is involved. Both Abhyandara and Bahya Roga Marga, not Madhyama Roga Marga is involved. Both Abhyandara and Bahya Roga Marga is involved. Mostly, Visarpa is starting from Abhyandara Roga Marga. It can manifest in Bahya Roga Marga. That is not the case of Vidradi. That's not the case of Kushta. Kushta, the manifestation is only happening in Bahya Roga Marga. This much discrimination is highly inevitable because if you are selecting the Nimbadi Kashayam for Vidradi, of course it can act in all Roga Marga. But if you are selecting Padola Gadarohinyadi Kashayam, it can act both Bahya Roga Marga and Abhyandara Roga Marga best in Visarpa. But in case of Kushta Samprapti, if you are selecting medicines such as Tiktagam Kwadam, its maximum effect is on Bahya Roga. So such a discrimination has to be taken into consideration while dealing with the management of all the skin diseases, not only in children. So our drug selection and the treatment selection is mainly based on 3 variables. Why I am confining only to 3 variables? Why? Because there are many variables, out of which 3 are mostly important. How much Kapha and Klayatha is vitiated? How much degree of Pitta is vitiated? Because the Pitta management and Kapha management is entirely different. If the Pitta is not taken into consideration while managing the Kapha, the condition may aggravate. Then extent of Dadus or Roga Marga involved has to be taken into consideration while managing or while selecting the disease. Diagnosis by morphology, Kabalam, Udumbaram, Rishijikhu and everything is similar to this traffic. Very difficult to manage. and to identify. But during the time of Brihatrayis, even though they have mentioned 18 types of kushta or innumerable type of kushtas, but finally at the time of management, they are telling that Vadhigam, Paithigam, Kabajam, and management is according to Vada, Pitta, and Kapha. So why this exercise had been carried out in Brihatrayis is another point of discussion. I am not dealing those theoretical and academic discussion of that point, but for practitioners' sake, what I am telling is, even though by morphology, there are many types of kushtas, you abbreviate everything into Vada, Pitta, and Kapha so that your treatment will be more easy, as did by our Charagacharya or Susrutacharya or Ashtanga Hrudayagara, because they have abbreviated everything in Vadottareshu, Sarpir, Vamanam, Shleshmottareshu, Pushteshu, Pittottareshu, Mocho Rectasya Virejanam Chagre. This is the treatment in nutshell in skin disease. The very same treatment is followed by me also, because I am very poor in managing or in diagnosing each and every morphological features of skin diseases which are mentioned in Kalpadruma. It is more than 60 types are mentioned. But if you are efficient enough to diagnose each and every Visarpas and Kushtas which are mentioned in Kalpadruma, the therapeutics will be more easy, and there are lot of medications are mentioned in Kalpadruma in a lock and key mechanism. But I am not able to do that. So whatever I am doing, I can say in this gathering, first number one step is examine the child for 1 minute. Some of my taskbar is 1 minute. Is it visible right now? Okay.
Yes, sir. That slide is visible. Step 1, examining for dosha.
Yes.
Step 2.
Yes. So examine for dosha first. Then look for the involvement of each dhadus. Then examine the presence of ama, which is not at all mentioned anywhere in the Kushta Chikitsa. But if you are not doing it, sure that the problem will increase. the main problem of the management in skin disease is initial aggravation of the skin disease after the administration of the medicine, which is creating a lot of headache to the physician. Then step 4, examine the nature of pitta, whether it is Bahala pitta or Prabhala pitta or whether it is Alpa pitta. This has to be diagnosed. For that, a simple tip is like this. If pitta is involved only in the throat, only bullous lesions and infective lesions are happening. If it is in the recta, no doubt that will be highly fast spreading type. If it is on the mamsa, that will be deep ulcers or gangrenous. So, in most of the skin diseases of the children, rasa rectas are involved in case of Visarpa and Kushta, but not in case of Vidradi. Vadika symptoms, you look into the symptoms because it is highly inevitable whether we need to take the Thaila for external application, whether we need to Kashaya Parishega for external application, or whether we need to have any other Lepa for external application. And for internal selection of the drug also, you should have a perfect diagnosis of involvement of dosha as well as dusha, that is dadu. If that skin disease is producing pricking pain, as we've seen in the case of scabies, if it is highly ruksha is chakshusha bhava, by looking into it, whether it is too rough, and if there is crusting, if there is vadika kantu means there are two types of kantus are mentioned in Ayurveda. One is vadika kantu, that is sushka kantu. Second one is ardra kantu. If one kantu is relieved by the application of coconut oil or any oil, as we seen in the case of the pruritus, which is seen in the winter season, if you are applying lukewarm oil, that will be subsided. That is vadika pruritus. But there are several oozing skin disease like eczema. There will be itching. By doing the scratch, there will be more oozing. That is kabaja kandu. If it is hyper keratinized and blackish, that is vadikam. If it is lichenified, that is vadikam. These are the main vadika symptoms which can be seen in the skin disease of everyone, not only the children. And these are the common symptoms like redness, pus of both pitta and kapha, burning sensation, fever, local rise of temperature, painful local lymphadenopathy. If the lesion is on the skin of the lower limb, if the superficial liquid lymph nodes are less, that is Paediatric symptom, acute progression. Within 24 hours, there will be fast spreading nature, that is Paediatric symptoms. Kapha symptoms are ardra kandu, lymphadenopathy will be there, that will be rubbery in nature and that will be painless. If at all pain is there, that will be mandaruk. Then pus will be there, oozing will be there, adjacent edema will be there. Instead of frank fever, there will be feverishness. Mandajwaram, feverishness. Then there are some urinary complaints, urinary retention complaints. All these are Kabhaja symptoms. Associated disease. In addition to the skin manifestations, you should take associated disease like in case of Vadigan, there will be arthritis. There will be Kumara genital emaciation. There will be in Paediatric, there will be associated diarrhea, bleeding disease. Many skin diseases are associated with gut inflammation and gastroesophageal reflux disease. Chandraprabha, I am supposed to wind up by 9 o'clock now.
Yes, sir. Yes.
Okay. Gut inflammation or gastroesophageal reflux disease. In Kabhaja association, there will be respiratory association like eczema, asthma syndrome. Iron deficiency anemia is Kabhaja Bhavasa. Ashma, Tojistidan Kudial Stabdam Shweda Vasam, Pandu Amayam Shonitago, Pandu Amayam Shonitago. Iron deficiency anemia is Kabhaja Bhava. And disease will be always presented in front of you in Samsargaja or Sandibadiga way. Not a single dosha predominance cannot be traced out in most of the skin diseases. In most of the cases, will respond to Vyadhi with the drugs with good results. That is the lucky part of each and every practitioner, that if you are doing Jara paracetamol Nyaya Siddhanta application of the medicine, skin disease, skin disease, any other kashaya, that will give result in many of the cases, but that will not give optimum results. Most of the skin disease will be presented as kapha paithiga in nature. Kapha paithiga in nature. Because more formulations are given, that you can see in Kushta Chikitsa, most of the, whatever may be your formulation like Patolagadranyadi, Arat Kodadi, or Vajragan Kwadam, Tiktagan Kwadam, most of them are kapha paithiga suitability will be there, or kapha pittahara, but out of which is more pittahara, which is more kapahara is more important. For example, Arat Kodadi, more kapahara, Nimbadi Kashayam, more kapahara, which is more good in Vidradi. Padola Gadravanyadi equally kapha pittahara. Padola Muladi give good virajana, initial drug for psoriasis, and which is simultaneously kapha pittahara, but which give more virajana property. In Vada Paitigam, more pittahara. It means that more pittahara, along with there will be some Vadahara property will be there in Kuduchadi, Kugrutagam, Kogilakshagam Kashayam, Sarivadhyasagam, Ushirasagam. These are the peculiarities that we need to take care of while selecting the formulations. In Vadagabajam, number of drugs are very less. Dashamula Rasnadi Kwadam, Villuadi Kuliga, Valkuja Bijadi Churnam. Such minimal number of medicines are there in Vata Kapaharam. And in management of Kladam, as I told you, always there will be vitiated pitta along with Abhishanti Vruddhatvam or Klada Vruddhi or Abhishyanda Sendana Bhava of Kapha will be increased. For that, you must do Klada Nirharanam. In the management of skin disease, if you are not doing Klada Nirharanam properly, the condition will recur whenever you stop your medicine. Not out. So for Klada Nirharanam, you should apply Punarnavadi or Punarnava preparations initially. Punarnava as Panagam or Punarnavadi Kwadam tablet along with main Kwada. If that much Klada is not there, you can have the Klada Soshanam like Manjishtadi or Kaishora Guru. Gochura Panagam can be given if the child is too emaciated. Whenever the Brahmana is needed along with the Klada Nirharanam, then Gochura Panagam can be given. If the Brahmanas are not needed, Punarnava Panagam can be given. If you need Kapha Pittaharatam simultaneously with the Shoshana, with the Klada Shoshana, that means severe eczema. Along with that, there is involvement of some renal impairment, staphylococcal infection with renal involvement. In all such cases, Klada Shoshana has to be performed. Dusparsha Panagam, Dusparsam Slashma Pittaharanam Sreshtam. Dusparsha can be Panagam. Rekta Vurdhijan, Rekta Nirharana Prasadana, Kaya Virajana, Prasadanam, Chodi the Prasadanam has to perform. The best medicine, along with the Klada Shoshanam or Klada Nirharanam, you can have Chodi the Amrita Gashayam or Satavari Chinnaruhadi Gashayam. These are the best medicine for the initial Chodi the Prasadanam, or the very same Chodi the Prasadanam can be given as a Rasayana adjuvant after finishing your treatment for long-term therapy. Chodi the Amrita Gashayam can be given. The Bhattya drugs are Sariva, cold water, medicated, Karavelagam, Pushmanda. All the Vallifalas are giving good Bhattya impact in the skin diseases. These are the usual prescription of our diet regimen. Sunday, Monday, Tuesday, Wednesday, Thursdays. These are the morning, lunch, evening snack, supper, and drinking water. These are the usual prescription what we are giving in our ward whenever we are admitting the children in our hospital, such as the diseases like epidermolysis bullosa. Apatyam, Bachadam cha Atapanalav, Rektavasroto Dustikarana. Exposure to severe sunlight, severe wind is not good for skin disease because it aggravates Rektadushti. All non-vegetarian foods are giving Rektadushti. Milk and milk products in general, even though it is Pitta Shamana, it increases the Klayada, it increases in the form of Abhishyanti, in the form of Klayada Vruddhi. Adhyasanam, very important. Most of the people are neglecting this point that eating overeating. Without production of hunger, again the child will eat whenever they are getting good foods. That should be restricted while treating the management of skin diseases. Maternal ahara vihara has to be customized if the child is depending on breast milk. Maternal ahara viharam has to be customized according to this principle of Abatya. Why the skin diseases are getting aggravated by the application of Ayurveda medicine? Or how can you prevent aggravation? See, aggravation is not a therapeutic. It is iatrogenic. It's wrong treatment method. Don't think that something is coming out and we are doing Shodhana Chikitsa. No, it's not like that. Nowhere in the textbook it is mentioned like that. You are not supposed to aggravate the skin disease by giving your medicine. In ama predominant Kabaja symptoms, in Kabaja symptoms, if you are applying oils, I already mentioned what are the Kabaja symptoms. If you are applying oils as external application, readily it will aggravate. Internally, Grida, if you are giving, readily it will aggravate. Initially, every Kashaya, mind it, because almost all the Kashayas are in the bottle, they have inherent Amatum, they are not Koshnam Murdukti Sadidam, they have Stampana property. Initially, every Kashaya will aggravate the skin disease. In general, I am not telling about the freshly prepared Kwada, which is not given with sodium benzoate. Initially, every Kashaya may aggravate the skin condition, so don't have the Kashaya in initial first day prescription. All these are I am telling to the beginners of Ayurveda practice to be on safe side. In such conditions, start with Aristas or Guligas, gradually turn to lukewarm Kashayas, which are freshly prepared, Koshnam Murdhakti Sadidam. Then Paithika symptoms. Look into the Paithika symptoms. Avoid Gugulu preparations like Kaishara Gugulu, Trubala Gugulu initially. And initial Asava Aristas are not good in Paithika condition because it will readily aggravate Pitta. Ushnavirya Kashayas are not good. Ushna Kashaya Parishegas are not good. But unfortunately, most of the Paithika symptoms are run hand in hand with the Paithika symptoms, are run in hand with the Kabaja symptoms. So, initial prescriptions should be free from Aristas and Kashayas. So, very limited prescriptions are more than sufficient to get good results in the first 7 days. Preferably start with the Kwada Parishega, Churnas, Guligas, any syrups, any patent drugs, or any rasa preparations like Rasa Sindhura. That will be the ideal one for initial shamanatvam of whatever may be the skin disease, if it is more Kapavaitiga in nature. Frank infective area, skin opened area, skin is a protective organ. In skin disease, if you are applying Churna directly upon it, it can induce a lot of infection. It will aggravate the skin conditions. Solutions: avoid Kashaya Kalpanas initially for internal use. Start with Aristas except in Paithika Vigaras. Avoid Google applications in Paithika Vigaras. Try to add Chopachini in every Kashaya as Chapachurna. Try to do Kashaya Parishegas initially, especially in Kapacha symptoms. You will get better results. Try to avoid Churna applications in skin initially. Jwaranabandhi skin disease. Treat Jwara first. Like Gopi Chandradi, like Panchadiktagam, like Padolaha, Pichumarda Kritamala, or Padolancha Tadandimbo, Bela Nagabala, and Kalingagaha, Padolasa Patran Rohini. These are the different preparations that can be used. Jwara first. Try to avoid Sneha Bahya Prayoga in fungal presence because Thailas are best fertilizer for fungal growth. Use Resuscitur and sure shot fire cases. Try to give drug for GERD because these pittas are readily aggravating skin disease. Pittas are getting aggravated in the costa. So by application of a combination of what I am usually using, Avibhati Churnam and Rajanayati Churnam combination is best for Vata and Lomana as well as Pitta Shamana. Try to treat that GERD for first solution for sure shot reduction of skin disease. And these are the different identifiable morphological features. Kabalam, Krishna Aruna Kabalabam, similar to this Kabalam. Aswadanam Mahavastu, get Matsya Sakalopamam, Matsya Sakalam, just like sardine, you can see. Eka Gustam, Charmakyam, Behalam, Hasti Charmavat. My point is, this is also one type of such a fungal infection. And here, these are the main area where Ayurveda people are getting a lot of bad results because whatever you are giving the application, it won't affect initially. In all such Vadiga area, you give Pashana Katina Parishe Sute Kuste Stire Purane Cha The best item for the Stabda Kushta is you use copper sulfate crystal, soak it, rub it twice or thrice in a week, and apply all over all your applications like ointment or any other perishagas or anything like that. You remove that unhealthy granulation tissue so that your therapeutic outcome will be more fast. Tuttua or Vilyuadi Gulika can be applied externally in Tulasi Swarasa, or Gomutra can be made into lukewarm and you can apply, make a parishega, or even Arishta, Kadira Arishta, Aragud Arishta can be made into gentle warm. You can make a parishega by diluting it. All those are giving good results for the Stabda Supta Suptanya, Swedana Kantulani, Kushtani, which are giving bad results with the conventional management. If you are looking into individual diseases, this is physiological desquamation of the neonate, no need of any treatment. If at all, this is more pronounced in post-mature babies. If at all you need to manage it, just apply Kshira, Karak Kshira, that means, coconut milk, Kshira Vrishakwata Snanam, only fresh coconut oil, which is lukewarm, can be applied over there. It will be resolved. Sebaceous gland hyperplasia, which is more common due to maternal androgen. This will be Kola Visarpam, or this will be Sarshaba Visarpam. And in all such cases, you can apply Naligara Seduddera Pishwa Badaram Kalkalam Pushpamba Karabi Badaram. Bedara Bija powder can be applied in coconut milk that will be resolved. Even without management, it can be resolved. Erythema toxicum neonatorum, just like flea bite appearance, even though you are keeping mosquito net on 14th day or 21st day, almost all the children will have flea bitten appearance on the cheeks. That will be secondarily infected by your talcum powder and your application of oils and soap powder or baby soap. All these are aggravating factors, and this is indicative of your child's immune system is proper, and Nalpamaradi, Karam, Chirivruksha Snanam is more than sufficient to get relieve this condition. And there are certain cutis marmorata. This is more pronounced in case of Down syndrome and congenital hypothyroidism. Web-like or net-like appearance of the blood vessels, cutis marmorata. This is very difficult to manage in children, but short management can be given by Elathagyadi Kashayam by Paediatric, Elam Maramanjal Yestiyum, Drakshayam, Patiyum, Purkila, Patyam Munum, Chetimunum Pura, Gobankanam Jabatandurak. This is Malayalam sloga, and you take a snapshot or screenshot of this slide, you will get the English terminology or Ayurveda terminology in English letter corresponding to that. And there are certain conditions in which Antarvisarpa is mostly pronounced as Revati Graham in children. There will be green stool diarrhea, there will be respiratory symptoms, there will be skin symptoms. Skin, GI to respiratory along with fever. That will be the combination. Whatever may be your medication, it will not give good fast results. Why? Because if you are treating the skin, it will aggravate respiratory. If you are respiratory, if you are treating, it will aggravate skin. Both of you will get aggravation in GI tracts. And fever has to be managed first. The short medicine is Makipuvadi Kwadam Gopi Chandradi Gudiga. Admin, please mute all. So, Makipuvadi Kwadam is mentioned in Vaidyadaragam, which is available in Kerala market in certain companies. Makkipuvadu Masakkumalli Jadikya Pulladi. That is the Malayalam slogan. Makkipuvadi Kashayam. If anybody is in need of, we can provide. There is one pharmacy in Palakkad district. They are preparing it. Even KV side with the pharmaceuticals. They are preparing for me too. Makkipuvadi Kwadam, Gopi Chandradi Gudiga, Agakara Paregi Dam Paniyum Chumamutalam. The combination spectrum of GIT, skin, respiratory, and fever will be simultaneously managed. Eczema asthma syndrome. You know, Amasya is the site of both Kapha and Pitta. The Pitta manifestation is eczema, Kapha manifestation is asthma. Simultaneous management is needed because Pitta is in need of Shita Guna and Kapha is in need of Ushna Guna. So it will be very difficult to treat such a condition. Tikta Rasa is the only rasa which manages simultaneous Kapha and Pitta. So Pajana Pradam, Panchadiktagam, Avivatirithine, the Haridragandam. These are the usual prescription from my side, Tikta Pajanam, Amasayastam. And it is very difficult to cut down the Sambrati for a long time. So we are administering this combination of Avivatirithine, the Haridragandam, at least for 2 years for the complete stoppage of the disease. In childhood psoriasis, we must do Shodhana Chikitsa after 10 years by applying Sadhyasneha, Parishega, Vamana, Videjana, Shaktika Labam to reduce the epidermal turnover. In case of psoriasis, we should do the Shaktika Labam in the form of Payasam, Shaktika Labam, Tritate, Tinctoria, oil, very minimal quantity of milk, and there is no need of Sarkara. Instead, you use Sita. This can be made into a payasa that can be applied all over the body. Finally, after Shodhana Chikitsa, Kushtahara Vasti. Actually, the Vasti is contraindicated in Kushta, but it is mentioned in Kushta Chikitsa in Charakasamhita Chikitsa Sthana. Darvi Brihati Sepi, Hipatola Vichupartha Kritamala, that can be used for such condition. Epidermolysis bullous, a very fatal condition, very difficult to treat, but palliation can be given. It needs Shodhana Chikitsa, not curable. That is common in many cases. Ayurvedic physicians don't get the first cases usually. Uddartanam, Shamana Snehavanam, Turaga Thailam, Karanja Thailam, internal application is warranted in such condition. Kashaya Parishegam, Khadira Kana Sattum. Khadira Kana Sattum means take 1 kilogram of chopped khadira sara, boil it in 10 liter of water, reduce it to 2 liters, sieve it, and finally again you reduce it by boiling, so that you will get maximum 300 to 400 gram of khana sattva that has to be used in such condition. Nityam snigdha virejanam may be warranted many of the EBS condition. Guluji, Ghadira, Sirisha, Chopachini. These are the 4 medicines which I am widely using in almost all non-tackling type of skin diseases. Guluji for Rakta Prasadanam and Rakta Rasayanam. Ghadira, Kushta, Knanam Srashtam, Shirisham. In almost all the skin diseases, there will be underlying Vishasamrati, so Shirisham, Chopachini, Vyadi Vindam. Arogavardhini, Sinduram, Chandraprabhan, Kukulu Panchavalam are widely using in all such non-tackling cases, because Arogavardhini for Rektavaha Mulosroda, Mulasthanam of Rektavaha Srodo, that is Yagartpliha, has to be managed in long-standing cases. Rasisinduram as Rasayanam, Chandraprabha is Kapapittaharam Rasayanam, Kukulu Panchavalam Churnam to stop the Gadi of Kushta. Further progression of Kushta, Kushta Bagandaragan, Gunma Gadikinam. In ichthyosis, Samarajikilsa is not curative, it is palliative. Ichthyosis cases are very difficult to manage till its cure. Treatment is almost similar to EBS. Special medicines are Vatankuradi and Jabankuradi Kashaya, which are mentioned in Vaidya Taraga. Again, that Malayalam textbook, take a screenshot, get a translation from the organizers, Jabankuradi Kashaya, and both these cases should be monitored with nutrition status, because most of these EBS and ichthyosis cases are getting deteriorated, deprived of nutrition by the continuous application of Patyahara by the Ayurveda Vaidyas. In all such cases, malnutrition is a comorbidity. The best management is Mamsarasa in all such cases, beneficial for Snehana. Vitamin A and D has to be kept in mind in the management. Skin specific kalpana of drugs like Atappa Kashayam, Kerala specific Kashayam. Almost all the Kashayas, Padas has to be prepared by open lid. But in Atappa Kashayam, it will be closed lid. Didn't allow the vapor to go out. We must put the drugs not in the water, but in a platform which is created by the sticks of or midribs of rachis of coconut leaf. You put the drugs over that and boil the water. This is the style of preparation of Adapakavada. Water Kashayam, take drugs in the paste form, apply over the Nagavalli leaf, then make it as a varti, wrap it within the leaf of banana, tie it properly, insert inside the deep cold, make it as a potapagam, and take it after 1 hour, grind it, squeeze it, take it. This will be more like goo, and that will have a good property to make immediate results. Then Karika Kashayam, Kashaya can be prepared inside the tender coconut without removing its water. Put the drugs inside the tender coconut. Then the lid has to be closed. Make putapagam and boil it. This will be Ishat Snigdha Kashaya. In ichthyosis, in hyperkeratinism condition, Karika Kashaya. Karika means tender coconut. Tender coconut Kashaya preparations are unique to Kerala. There are several types of yogas are mentioned in Vaidhitaragam. This can be used whenever you are in need of snigdhatvam. All we know, if you are applying gridas, it can increase abhishyanta swabhava, it can increase klayada without much increasing that klayadatva. If you need snehana, you opt karika kwada, that is tender coconut kwada. By this, winding up, thanking you. Thanks to the all organizations and the audience for patient listening. And obviously, these slides are in need of great discussion if you absorb it properly. And let us open the session for discussion, it seems. Dr. Chandraprabha, please.
Yeah, thank you, sir. Thank you so much for such an informative and motivating session. Actually, it was really amazing learning experience, and I'm sure participants will be ready with their questions and queries. So I think we already have a question. So, namaste, sir. A 4-year kid, papules all over body, treated as allergic reaction, given steroids, but we observe that it is due to mosquito bite. Only by Nidana Parivarjan and started Haridra Ghanta. Now the kid is healthy. What about your view and how to manage this? Please guide, sir.
You told that now the kid is healthy. So your management is the ultimate management, no doubt. Number two, whenever you are looking into the allergy cases, mind it, it is not the problem of mosquito which created allergic reaction. It is the problem of human body which has created allergic reaction. Because the very same mosquito, if it is bitten on another body, that body doesn't respond as allergic. What does it mean? Mosquito is not the culprit. Culprit is human body. And its allergic reaction has to be managed. Allergic reaction, I have already mentioned. The continuous application of my combination is always Rajanya Javipati Haridra and the continuous application. Along with that, most of them are creating Kapapaitika with increased Kleda. So initially, Kleda Narharanam by Purnatavadi, then later turned to Kapapitahara like Patolagadra is the drug of choice according to my view. Which
Thank
company
you,
manufactures Makipuadi Kashayam? CNS. And according to CNS is in the open market, and you can have this yoga from Vaidyataragam. You can prepare it yourself. That is the best idea.
Thank you, sir. So one more question is there. White patches even after Krimi Chikitsa and zinc supplement.
The
How
white
can we
patches,
manage?
the deficiency has to be managed not by supplementing it. Even though if you have 3 children, one is having zinc deficiency, others are not having zinc deficiency, everybody is given with the same food. What does it mean? It is not the deficiency of supply. It is the problem of system to handle the food to get the zinc properly. So treat Agni properly. For that, Rajanyadi is the best one. The Krimi is not causing that much zinc deficiency. Actually, your system is in trouble. So, Slashma Tojistidam Kudyal Stabdam Shvedava Basadam. Kapha in Tok is creating this Shvedava Basadam. So, do Kabahara Chikitsa like Arakuda di Kwadam and Rajanyadi Churnam and Kribiknavadi. Such a combination will give you good zinc management, not supplement. Supplement is not a good choice anywhere, not only in zinc, but in case of vitamin D or any other supplements are not good. Sir, would you please mention the options for Virajana for children below 5 years? Below 5 years, Virajana are not good. Better you go for Mrudu Samshodhana. For Krura Costa and Mrudu Costa, best is Hridya Virajanam and Kalyanaka Gulam and the pulp of this Aragvada. These are the best medicines.
Sir, one more question has come. Sir, cracks and thickening over sole of feet which shed periodically with white patches over the
Toji is Putana Rukshada. It is Vada Vyadi, not a skin disease. Toji is Putana Rukshada. Bahya Abhyantara Sneham is inevitable. So Jivandyadiyamagam Parandyadikaram external application. Along with that, internally Arakuda Mahatha Gridam like Grida has to be given, and Ruchahara has to be stopped, and Snigdahara has to be enhanced. Continuous proper quantity of water intake processed with the Sariba will give you much good results. Vaidya Karagam, not Vaidya Karagam, but it is Vaidya Taragam. I will type it Vaidya Taragam. Okay, not in English language. I am trying to translate it, but the fate of Ayurveda book is nobody is having the reading habits. If somebody is publishing it, it will stay in the God-owned assets. How many of you read my book, Clinical Pediatrics in Ayurveda? Clinical Pediatrics in Ayurveda. So, Clinical Pediatrics in Ayurveda. Say, this covers 31 clinical conditions. Similarly, as I took in this session, 31 commonly clinical condition. Yes, Gautam Dhruv read. Yes, I have this book. Wow, thank you very much. Many of the audience are purchased it. Sir, can you explain how to treat dry skin? I told you, dry skin has to be managed with Togasrada Vayu. Togasrada Vayu Bahya Bindra Sneham. I have your book, sir. Thank you very much. Venkata Narendra, thank you very much. Okay.
I think everybody is having the book.
Yes, how can we purchase your book? You just have a WhatsApp in 9744 98529. You will get that. Dr. Deepa is also here. Yes. Good. Thank you.
So somebody is curious about the pricing as well, I guess.
Price, I don't know. You just asking that. I don't know what the price matter. It is somewhere around 300, it seems. I don't know that. The publisher is doing that business and I'm not doing it. You just have a WhatsApp. Somewhere around 300. 9724 98529. Yes. Thank you.
Do we have any other questions, relevant question regarding to the topic, or are we good to wind up? I think we are done. I don't see any more questions from the audience and from the participants. So thank you, sir, and thank you everyone for participating in this webinar session. And we have one announcement that we are conducting another 2-day webinar session on Svedana by Dr. Remya Alakkel. It's on 6th and 7th of March. So all are invited for the webinar session. Once again, thank you, sir. Thank you all, and good night. Thank you.